Dr. Barbara Washington, cardiologist. A lot of patients have apprehension when they're meeting a cardiologist for the first time. So actually I do try to talk about, get to know you as a person first and ask, where you're from, what kind of work do you do, and kind of your experience with the medical care providers in general so that I can talk to you in a level that will be able to facilitate understanding. Typical first appointment actually will be very thorough. I like to go through your whole medical history, so be prepared to talk about yourself, all your medical problems, and your experiences that you've had with prior cardiac testing or with any previous episodes of going to the emergency room. We will actually customize your care according to what you're comfortable with. I don't like to treat people as if they're on a factory express line. Preventative care for cardiology is something that a lot of people forget, is that overall your risk factors for whether you will develop a heart attack. So we talk about how much do you exercise, what kind of diet do you eat, are you eating living a heart healthy lifestyle. And so preventative cardiology is also a big form of my practice. I think patients really find it easily to open up to me naturally because people can tell when you care. And so I think that by just presenting, taking time to listen to what someone says, I do feel that it's very important that the patient does not feel rushed. The conversation is not on a time clock. Of course, in today's patient care environment, that's sometimes not realistic, but I actually will have people say, do you feel you need more time? Let's make another revisit, because I do not want you to go into any of your testing confused or anxious. And lots of times we will reschedule appointments if necessary. The physician-patient relationship is so important when it comes to cardiology, because we can prescribe the medications as cardiologists, but there's still a need for you to do the basics, which exercise is the most important foundation of cardiac care. Exercising and eating correctly, and also knowing yourself, your symptoms, by learning your own body on a consistent basis, exercising regularly, trying not to smoke, trying to lose weight is so very important. I have many people that we have done major surgery. Unfortunately, it is many people. They go for open heart surgery and they still smoke cigarettes and they still eat the same high cholesterol diet. So most of my patients, number one, feel that I'm a very well-trained physician. I've had that statement made. Thorough, dedicated, and caring.